We want to welcome Denise N. Bronner, MD, and Marsha Calloway. Did I get that right? I hope so. Okay. Okay, so Dr. Denise N. Bronner, I hope I pronounced that right, is a patient-focused strategist with five. Did I get it right? Dr. Bronner? Okay, I got it right. Dr. Bronner is a patient-focused strategist with 5+ years of experience developing global operational plans that have maintained a robust track with DEI recruitment goals. Dr. Bronner, okay.
All right, hello everyone, welcome. This is our session. We're going to be talking about healing hearts and the importance of representation in cardio research. So I'll go ahead and let you introduce yourself.
So good morning, everyone. I'm Dr. Jabbar Swain. I'm a medical executive at Johnson & Johnson. And in my role, I work with health systems across the country to understand gaps in care. And clinically, I'm a cardiothoracic transplant surgeon. And so I do heart and lung transplants for patients with any organ disease.
Very nice. So, with the two of us, representation is very important, right? And when we think about cardio health, I think many of you have heard about heart disease. But really, I wanted to, throw out the first question for you. What are some of the biggest myths when it comes to cardio health, especially in the Black community?
Absolutely. So there are three that really come to mind. And the first one that I think many of us have probably heard is that cardiovascular disease only happens in old people. And a lot of times, when you go to certain screening events, they'll, start looking at people 65 and older. However, what we've now come to learn that cardiovascular disease can affect individuals of all ages, even children. And so we have to be mindful of our activity, diet, and exercise. And so I thought it was really wonderful that we had that activity session today, and we're going to have another session later on today, because that is kind of the foundation in which we begin to become more proactive at preventing cardiovascular disease.
And I have to say, you think about heart health, like you said, they think about it mostly in old people. But I think the other thing too is what would be some of the signs that someone should be looking out for, especially when you're a little bit younger or you're thinking, hey, I lived a pretty good life, I'm eating okay. What are some of the things that they need to look out?
Well, I think that actually lends it to my conversation to a second myth that often we have, is that if I don't have symptoms, I have a healthy heart. And so a lot of times we have patients who come into the emergency department, they've been completely healthy in their mind, they've not had chest pain or any other side effects or symptoms rather, and all of a sudden they come in and they may have gone and had their blood pressure checked, and then they start having chest pain, and then they realize that they've had a full-on myocardial infarction. And oftentimes it comes as a complete surprise, because before then they don't have side effects, or rather symptoms. Another instance is that we often think that men are the only ones who have cardiovascular disease, and we understand men often are at greater risk, but cardiovascular disease affects men and women. And the unfortunate, idea behind it affecting women is that it often is either asymptomatic or atypical, in the sense of atypical meaning the pain that normally would present with substernal or retrosternal pain that radiates to the left side is often not what we classically see in women, and particularly women of color. And I think as a culture, we grow up with aches and pains, and it's very easy for us to say, oh, I woke up like this, and, write it off as something that's a part of our natural everyday experience. But understanding that it is important that if you do have a pain, just as they say in the airport, if anybody has gone to the Atlanta airport, over the intercom, they'll say, if you see something, say something. Same thing about the pain and discomfort or any type of symptoms that you have from cardiovascular disease. If you feel something, make sure you say something, because you could very well be encountering a myocardial infarction that can affect the rest of your life.
Yeah, because it's very interesting when you talk about the differences in symptoms, right? Because like we said, when we think about a heart attack, typically you hear about the chest pains radiating down the left side of your arm. But for women, I think they were also saying that it can actually cause pain in their jaw as well, right?
Yep, you can have pain in your jaws. Some people have headaches. There are some that report having just diffuse sweating beforehand. I know I actually was doing a telemedicine visit with a patient, and she lives in Georgia, and we were having a conversation, and I understood that it was warm, but she was indoors and there was air conditioning, and she kept fanning during the conversation. And I was like, "Ma'am, are you okay?" And she's like, "Yeah, it's just hot."
Right, hot flashes, what are you talking about?
Yeah, hot flashes. And I was like, "Well, you have the air on and you've been fanning for the last 15 minutes. And so I had her check her blood pressure, and her systolic blood pressure was greater than 200. Yes. So we had her immediately rushed to the hospital to try to get that down. And before my eyes and without her knowing, she was in the process of having a myocardial infarction. Her troponins were elevated, and so she did have to be admitted for care. Thankfully, she was able to overcome that circumstance, but it was just a simple, "Oh, I'm having hot flashes," or "Oh, I'm having pain. It'll go away. I've had it before." And one thing we're very, commonly that we do when we have muscle pain, we put ice on it. And we think that, oh, well, this will help allay the issue. But if it's recurring, and then if it's something that you're not able to reproduce, because usually musculoskeletal pain, when it presents, you can move a certain way and it will come back and you can reproduce the pain. But if it's naturally occurring pain that you can't really feel for it and it's happening on the inside, it likely is probably one of those atypical presentations of cardiovascular disease that warrants immediate evaluation by a physician or healthcare provider.
And it's very interesting too when you think about how, when you think about high blood pressure and other types of medication that are used, that there can be key differences across races. One of the biggest things when you think about with blood pressure, typically they'll give you like an ACE inhibitor, right, or a beta blocker. But there's been a lot of research coming out now post-marketing that shows that, a diuretic or, calcium channel blockers seem to be better for Black people.
Yeah.
Can you talk a little bit about that?
Absolutely. And I think part of that post-marketing research that occurs is because we don't have adequate representation in our clinical trials. What we're moving more towards, or what we're better beginning to understand, is that a lot of how disease processes present, and not only cardiovascular disease, but other disease processes, oftentimes there can be variances based on our biology. But we may not learn about those variances if we don't have the right subjects involved in our trials to be able to see how different molecules behave. And so there have been a number of occasions, and it still actually happens, where the scientists create a molecule, they think it's a breakthrough, they enroll patients in a trial, but it's a homogeneous representation of individuals in that trial, meaning that everybody in the trial is white or everybody in the trial is Hispanic. And there's no variety or diversity in the context and the content of individuals that are involved in the trial. And so what we need to now understand is we need to encourage, one, the participation of particularly people of color, so that we can understand really clearly how our biology differently reacts with molecules. And, it's certainly understandable given the storied history that people of color in the United States particularly have with trusting medicine and particularly clinical trials. We can name a number of different historical contexts and even recent contexts where it's felt like there's been experimentation. But I think we have to provide more education around the fact that if we don't participate in these trials and we aren't able to develop patient-centric medications, then you can end up in a scenario where a physician is prescribing one of those medications you named, and they're not effective at managing some of the conditions that are preventable. So I think it's really important that we be represented in those trials.
Yeah, and I definitely have to agree. In my experience of helping to kind of design clinical trials on a global scale, when you look at Black representation across different diseases, we're very, very low. We're usually like maybe less than 10%. And when you think about a lot of the drugs that are on the market right now, we are not represented, as you said, in that data. So when you're looking at baseline, or when you're looking at the efficacy or effectiveness of a drug, we're not in that sample. The only time that we get included is when the drug has already been approved. And by that time, you guys are collecting that data for them. And that's when you start to see the adverse events or side effects starting to come out. That these things could have been identified if we were actually being pulled into the study. So I wanted to really kind of talk into, like in your current job, how are you helping to kind of raise representation?
Yeah, I feel lucky and thankful to work for Johnson & Johnson. When I first entered medicine, pharma was often looked upon as the enemy. They were just in it to get, the money. But, Johnson & Johnson is one of the largest global healthcare infrastructures in the world. And so because of that, we see it as our responsibility to take the lead at bridging the gap for health disparities. And one way in which we're doing that is through our $100 million investment over 5 years to provide resources and create community around leveraging the gap and providing, full range of enterprise-wide resources. Some of the initiatives that we have that are, quite unique and forward-thinking is our initiative called My Health Can't Wait. And it's a enterprise-wide platform in which patients, providers, and others can access resources free of charge. You just go to the website, myhealthcan'twait.com. And when you scroll through, there are like pamphlets, there are interactive guides, there are short videos for education, and just a number of different resources. A second initiative that we have that is really critically important and true to my heart because it's within the cardiovascular metabolism space is Save Legs, Change Lives. And it's an initiative that many of you may begin to see in your communities where Johnson & Johnson is taking not only education but screening across the country to various activation cities and offering that screening free of charge to vulnerable populations to identify whether or not you are at risk of developing PAD or whether or not you actually have PAD or peripheral artery disease. And this is critically important because peripheral artery disease is a consequence or a sequela of diabetes, so a disease that is very prevalent amongst people of color. Now, the unfortunate consequence that is happening across the country in a variety of spaces is that when people of color develop peripheral artery disease, they're not being offered the opportunity for revascularization or limb salvage. And so that means when they develop this disease or the peripheral artery disease, there's an interruption of the blood flow to their lower extremities. And you begin to develop pain and ulcers and other issues. Now, there is a process in which you can restore that blood flow in some patients, but rather than being offered that consideration, some people of color are being amputated. And at an alarmingly high risk. And so, there's something that before we never really talked about, but I think it's becoming more and more at the forefront because particularly Black men are being amputated at a much greater risk than any other group. And so Save Legs, Change Lives helps bring visibility around the country surrounding that phenomenon, but more importantly, tries to provide education and preventive awareness to help people of color particularly, but other communities as well, with the resources and tools to avert amputation. And then I'll finally end with one really interesting initiative that we have that our president here mentioned earlier, and that was the lack of representation within demographics. For instance, like if an individual comes in with psoriasis or eczema, when I came through medical school, we had very little examples of what that looked like on Black skin. And so because of that, that has often led to prolonged diagnosis. And, the way that psoriasis or eczema presents in a person with increased melanin is completely different. And so in order to help assist that process in learning, particularly amongst medical providers, but also so that patients have an opportunity, Johnson & Johnson has committed funds behind a project called Illustrate Change. And you can actually go online. There's the website called illustratechange.com, I believe. And it has a select of images that represent common disease processes that we typically would see represented only in non-melanated populations, but they're now in people of color. Yeah. And so it's the first time that you've seen a corporate sponsorship around illustrations for Black people, because you now can see yourself represented in the illustrations, but it also provides a tool for the healthcare providers, doctors, nurses, and others to be able to identify more accurately some of those disease processes and get to the diagnosis much sooner.
Yeah. And I would also say, too, there's a few others that we're doing at the company as well. We actually have 2 tables here that are in the back. One being our Research Includes Me, which is more on a side of trying to increase awareness and education about clinical trials. And so the whole point of that campaign was really to help to educate what does it mean to actually participate in a clinical trial, what are the expectations, what are your rights as a patient, where can you find these type of trials. And it was more to help educate and not to market to patients. Because a lot of times you'll see a lot of pharmaceutical companies that come in and market because they want something out of you. We really wanted to make sure that we empower patients or anyone who goes to that site. Another one that we've been working on, which is within inflammatory bowel disease, is really to kind of, again, showcase Black people and other types of patients within inflammatory bowel disease. And this is something that, again, when you see yourself represented, you start to pay attention more to it. You feel as though maybe you are actually trying to reach out to me. And so this is why I think working at the company that we both do has been life-changing, because we've seen a lot of patients like yourselves who've seen our materials, who've come to these types of events and have said, for the first time, I actually feel like someone's actually talking to me, someone who's actually highlighting my need and not just trying to get something out of me. So I really like the idea that we have these many different campaigns that are not trying to market to you, but more to educate you and empower you with the tools that you need. But I do want to talk a little bit more before we show, that awesome video, a little bit about My Health Can't Wait. So what has been some of the biggest things that you guys have been able to accomplish with that?
Yeah, no, I can't take credit for it. Some of my colleagues here, Dr. London Wills and Dwayne Reed, are here in the room. They've really been the champions of that initiative. And it's a, enterprise-wide representation of some of the most common disease processes that affect people of color and marginalized populations. And I think the glory behind it is that it is unbranded or above brand. So it does not involve pushing a drug or, trying to influence you to take one medication over another. But it really does look at, when you go to the website, you can click on diabetes or hypertension, you can click on stroke, and it provides you with just free resources all around how to manage, care for, and even some resources around patient advocacy groups and other things. It's still a continuous process for us, so we're adding things every day as we think about how better to leverage resources and create partnerships in the community. But I think it's a really great, clean first start for an organization like ours at the scope of us. And it is our hope that not only we continue to move the needle, but that other corporate sponsors in our space will take on the leadership as well to help bridge that gap. And so we don't have a table here today, but we certainly have representation across the Janssen franchise, and certainly feel free to, pull one of us aside, and we'd be happy to go through the website for you. And then we'll show a video shortly that kind of explains it.
I would go ahead and show the video right now just so you guys can see what the campaign's about.
In the U.S., many people of color face significant barriers to access healthcare services and vital information, which negatively impacts their health. But what happens when people do have access to the resources they need to take control of their health?
What happens when communities are empowered to take action? Communities of color can thrive.
Johnson & Johnson presents My Health Can't Wait, a community wellness initiative helping people of color in the United States access essential health information and resources.
Sponsoring community wellness events across the country, these local events encourage community members to prioritize their health and empowers them with the knowledge and resources they need to own their health journey.
These resources focus on health conditions that have a serious impact on communities of color, providing crucial support like health screenings and educational information.
I think not only educating people on the importance of these screenings and what we're teaching here, but giving them access to those screenings as well, and get them to encourage their community members to go get screened or go to the doctor and get tested.
I want individuals to know that there are resources here and be intentional about taking steps to engage the healthcare system and make it benefit you so it can benefit your family.
This support continues online at myhealthcan'twait.com, a free central hub for patients nationwide to access expansive resources covering critical topics like heart health, stroke, cancer, mental health, and much more.
I think the difference about what we're trying to do with this effort is to not just talk about health equity, but to actually do something about it.
There's so much more that we can do together than individually. And when we partner together, the community is able to win.
At Johnson & Johnson, we're working to close the racial health gap so that the color of your skin no longer determines your access to care, quality of care, or health outcomes, because your health
Your health
Your health.
Your health can't wait. Visit myhealthcan'twait.com to access resources and learn more.